All right, to use natural oxytocin stimulation in the event of a stalled or slow labor. So it can be really common for your surges, your contractions to take a rest and just stop for a while. Sometimes I call that resting labor because it doesn't necessarily mean that your labor is like stalled and shut down. It just means that your body might just need a rest. And it can be a really lovely time to go use the bathroom or take a walk or take a nap. That's usually the number one thing to do if your labor rests for a while. But when you're ready to get it started again, often Pitocin is offered in the hospital, but you can ask to do natural things like a nipple stimulation, which can stimulate the release of oxytocin, making out with your partner, walking around a little bit, doing lunges. I'm going to cover things that you can do to naturally induce in another video, but just ask them to allow you to try out some natural methods before going to medication. Or if you feel like I want to get this going and I want the medication, get the medication. There is absolutely nothing wrong with that. All right, so during birth, this is the phase where baby is actually coming out of your perineum, your womb. We request to birth in an atmosphere of gentle encouragement during the final birthing phase without coaching. Please, calm, low tones, free of pushing prompts. I talked about this in a past video. You might want that really calm, serene environment. That might feel really good to you. If so, definitely have this preference. But if you want that louder, high energy experience, then you can ask that. You can even write that in your preferences. Like, I really need a lot of encouragement and instruction during that final phase. Let them know what you want either way. And you can also change your mind. If you say that you want that really high energy environment and then it starts to stress you out, you can say, oh, whoa, I want the opposite. Or if you think you want the calm environment, but it's just like not working for you, you can ask them to speak up and coach you through it. All right, allow up to 30 minutes if necessary for natural placenta delivery. This is pretty common. You might not even need this in your preferences because unless there's medical urgency, your care provider is likely going to allow your body to birth your placenta. After your baby emerges, you're going to continue to have those surges, those contractions, and that is going to get the placenta down and out. Sometimes it can take up to 30 minutes. Usually it happens a little bit quicker. Your care provider will be down there kind of maybe doing a tiny, not tugging, but just kind of seeing if it's making movement. They're going to be monitoring your blood loss. It is totally normal to have some vaginal bleeding after you've just had a baby. Don't be alarmed if you see blood. And you can trust that your care provider is monitoring the descent of your placenta. And this is also a time that if you know that you want to save your placenta, let them know because they will dispose of it if you don't let them know you want to keep it. All right, so for baby, we request delay cord clamping and cutting until after pulsation has ceased. This is actually pretty common protocol now in a lot of hospitals, and almost all midwives do this. And it doesn't mean that your baby's going to be attached to the placenta for hours and hours. Usually the cord stops pulsating just after a few minutes. And the reason why a lot of care providers used to do immediate cord clamping was because they thought that this reduced a mother's chance of hemorrhaging. And recent studies have proven that it doesn't increase or decrease the mother's risk of hemorrhaging. It really doesn't have an impact on that. But not allowing the cord to finish pulsating can increase the baby's risk of some iron deficiency and about like 30 to 40% of the baby's blood is still being sent through the cord after they come out of the body. So they're really being prevented from receiving some nourishing good blood. So allow that cord to complete pulsation. You might need to remind them. Sometimes in excitement, it just gets clamped ahead of time, maybe by a hasty nurse. So you can have your care or your companion let them know that you just want to just hold off just for a minute. In the case of a medical emergency, they might need to do it a little bit quicker. And that's okay if the cord is clamped before the blood has finish moving into baby, it's not going to incredibly affect their health. So you don't need to be worried if that's something that does need to happen. You can really trust your care provider and trust that they're going to do the best thing for you and baby, if you've chosen a care provider that you trust, which I hope you have. All right, let's see. So delay use of eye salve or ointment to allow optimal site for bonding. So there is an eye ointment that is commonly given in hospitals and most birth centers. And the reason for this ointment is that if a baby is exposed to certain STDs as they're moving through the birth path, it could leave them susceptible to going blind. This is incredibly rare, and you would have had testing for STDs through your prenatal care. It is protocol in most hospitals, at least in the United States, to give all babies this eye ointment just in case something was missed. And the reasoning in delaying this is because it can make baby's eyesight a little bit blurry. Their eyesight is already incredibly blurry right after they're born. And if you can just ask for it to be delayed maybe like by 2 hours or something like that, then you can have that eye contact with baby before their eyesight gets even more confused. And they ask that the eye ointment be given in the first 24 hours. So you have a window there. Some hospitals, they just kind of want to do it to get it out of the way. So you're not putting your baby in additional risk by delaying for an hour or two. It's totally fine. But if you have any questions, please ask your care provider, ask their opinion on that. Okay, so the next one is oral vitamin K to be used if available. This is a really great question for your care provider, because there is the option of oral vitamin K or an injection of vitamin K. And some people believe that the injection is more effective. Some people think that the oral dose is fine. I'm not going to tell you what to choose. This is a really important question for your care provider. The reason some people prefer the oral, and the vitamin K is to help babies blood clot. So it is, in my opinion, something that's really important. But talk to your care provider, get all the information. The reasoning behind the preference that some people have for the oral vitamin K is that after baby just came out of the womb, it can be a little bit jarring to then give them a shot. So if you can give them the oral dose, it can be a little bit more calm and less intrusive. But again, a really good question for your care provider.